Hey there, Dr. Tyler Williams with Better Sleep SLC, and you're here because you have some questions about the dangers, the risks of sleep apnea. And there are quite a few of those, and we won't go through all of those here today, but a couple things to keep in mind is kind of how that works. And what most types of sleep apnea are, not all, but most, is when the muscles at the back of your throat, they, with age and time, or with changes in health or diet or weight, they get more relaxed, and so because they're not as tight when you go to sleep at night and you breathe, those muscles sag and relax and they get in the way and they cause snoring or noise. Or for some people there's no sound at all, no snoring sounds, but they still stop breathing. And many people we see stop breathing actually hundreds of times throughout the night, and this can increase your risk of things like heart disease, stroke, diabetes, and accidents from daytime sleepiness or daytime drowsiness. And this is a very common condition. People can fall asleep really easily, or headaches, lack of concentration, feeling a little bit off too often, and that can be caused as a result of sleep apnea. It's kind of a side effect, especially when it's not treated, and you should know that you have options and there are things you can do to treat that. And that doesn't necessarily mean you have to have surgery. It doesn't necessarily mean you have to wear a CPAP. Although those things may be recommended for you, the sooner you find out, the more options you have. And that's the great thing, because now we have CPAP, which have been around a long time. We have different types of surgery. And we have oral appliances that you wear on your teeth that actually prevent your tongue from getting in the way and blocking your airway, which is very commonly what happens during sleep apnea and causes you to stop breathing multiple times or even hundreds of times during the night. One thing to keep in mind is, there's not any one that's right for anybody, but by finding out sooner and getting a diagnosis, you can really get some answers. And almost everybody we treat with sleep apnea reports that other areas of their life get better as well. More energy, more focus, less problems with their teeth, less dry mouth. A lot of people are able to cut down on other medications. There's a lot of great ways that this can really help you. The first place to start is getting a home sleep test, and that's where we prescribe a test to be sent to your home or that you pick up at your physician's office, and you'll take that home and sleep with it 1 to 2 nights, and then it gives a whole bunch of measurements and recordings, and then a board-certified sleep physician will give you your results, and then we'd like to sit down with you and go through those results one-on-one. So if that's something you feel like would be beneficial to you, or you have some questions, or maybe even had a home sleep test before and you weren't quite sure what it meant, and especially if it's been a couple of years, it's probably a good time to get retested. There's newer technology, newer ways to do this. The technology keeps improving, and we can help you get the answers to the questions that you're looking for. It's a lot of fun for us to help people work through these problems and be able to just feel better about life and get some answers, and hopefully have fewer medical bills this way. So give us a call or shoot us a text. Our contact information is below this video, and we'd be happy to share more with you on what the next steps would look like. So thanks for watching this video, and we will see you on the next one.